Well, good morning, everybody. And I know that a lot of you have traveled some distance, many of you, to be here and attend this very, very unique and historic conference where we have leading scientists and clinicians from both coasts who have decided to come here to New Mexico and join our faculty and clinicians at the University of New Mexico, and also to hear from practicing clinicians from our community. This particular group of inflammatory neurological diseases that will be discussed over the next few days is quite unique, I think. And speaking as an emergency physician, we don't get a lot of this taught to us. We don't even teach it very much in emergency medicine, but the presentation is often in the emergency department. And the rapidity and the severity of how patients present is just extraordinary to me. Initially presenting with often very vague complaints, but within hours rendering the individual paralyzed, potentially maybe even blind, and in some cases even may lead to fatality. So we're going to be hearing over the next few days about new discoveries in the laboratory. I was struck by the grand rounds this morning in neurology, listening to Dr. Kerr and his discoveries at Johns Hopkins. And we'll be seeing how these discoveries in the laboratory can be tested in a controlled environment in an academic center. But most importantly, how these discoveries will then be made available to the practicing clinical community so that all patients in need will have access to those. That's an example of truly translational and clinical research, and those are the keywords for the current trend in federally funded research. The problem is that in order to really make this happen, there's certain kinds of research that the federal government won't fund, primarily in the form of embryonic stem cell research. And at least here in New Mexico and in a few other states, there's efforts at the state level to identify funding to allow us to pursue that. This past legislative session, we were almost there. We were able to get the governor's support for $10 million to support some research facilities at the School of Medicine here, but we were unable to get this passed through the legislature, and we'll be giving that another effort this next session. I'd like to thank Leslie Morrison, who most of you already know, who helped design and plan the conference. I'd like to thank the Cody Unser First Step Foundation, who inspired the conception of this symposium. And I don't know if Mary Beresford is here, but also the Office of the Governor's Commission on Disabilities that helped us fund, financially support this conference. But I do want to just spend 2 seconds talking about this young lady who introduced me. The segue into this is going to be Leslie Morrison, because Leslie was the inpatient attending when Cody presented to UNM Hospital when she developed transverse myelitis. This happened when she was around 12 years old, and over these last several years, she's taken on the role of crusader and ambassador of hope for tens of thousands of people of all ages, of all races, all around the world. She's legendary for her scuba diving, her congressional testimony, and now she's taken on the Unser family tradition, and she's even driven a race car. She serves as a role model, not just for people with disability, but for all of us who refuse to let anything get in our way to achieve our dreams. And so, please, would you join me in recognizing Ms. Cody Unser and her extraordinary accomplishments? I thank you all again for joining us today, and I'm hoping that collaborations and friendships that will be developed here will go on to help us create even better treatments and hopefully some cures. Thank you very much.
I just wanted to say a few words. In the 2006 legislative session in New Mexico, the legislature, in their wisdom, gave us some appropriation for quality of life grants. And what is quality of life? That depends on the individual. There's so many different types of quality of life. What our agency, as the Governor's Commission on Disability, is we focus on the cultural aspect to try and improve that quality of life. In fact, next month we will have a symposium to just try and qualify what a quality of life is for a person who is disabled. But with this quality of life funding that we received, we were able to help fund this symposium here, and we're very glad to do it, and we think it's very worthwhile. And I thank the legislature of New Mexico to be able to provide that for us. Welcome, and thank you for coming.
Well, officially welcome to Albuquerque, New Mexico, for those of you who came from afar. And I have several people and groups to thank, but I wanted to talk just a little bit about how this really happened. And that's that as Cody dealt with her acute disability, in a way to get through that process, I think she found that this advocacy was going to be the key, and how she could really promote improvement in healthcare through something bad that happened to her. And as she began to recover from this disease, she was able to go to many different institutions and see many different world's experts in transverse myelitis and other forms of paralysis. And as she started moving herself around the country, seeing different people, her dream was really to bring everybody back to New Mexico at some point, to collaborate with the doctors here at UNM, to collaborate with our community of patients in Albuquerque and New Mexico, and to help promote better health care. And I guess I could say the audacity of hope that someday there could be a cure for this disease and related diseases. So there's a lot of connections between the different diseases that we'll be talking about. We're going to talk about the similarities in these diseases, and we'll be talking about the differences in these diseases. We're really fortunate to have real, true world's experts here today. In addition to our invited faculty, we also have local doctors, and we really expect every participant in this room to be contributing to our discussions, because this is really where the richness of conferences like this come in. We're very fortunate we have medical students here. We have the chair of physical therapy here. We have residents. We, in fact, have a resident who's presenting later this morning. So we really have an educational focus here. We really have a clinical focus. In other words, what can we do to help our patients? And we also have a research focus to bring that to the community in a translational way. I'd like to go from the presentation in the emergency room that most of you went through when you became acutely paralyzed, on through the care that you've received from neurologists and other physicians, and then into the rehabilitation and the mental health consequences of these diseases. I'd like to acknowledge the Governor's Council on Disability, who provided the bulk of our funding. TIVA also provided some funding and has a booth today. We've had a lot of help from local resources at the university with continuing medical education. Michelle Hale, if all of you could please thank her. She has been completely tremendous. She's done a phenomenal job. We'd also like to thank, of course, the CUFS, Cody Unser First Step Foundation, which is really Cody and Shelley, and I think other people help as well. I'd like to thank my chairman, Gary Rosenberg, who lets me do things like this all the time, and all the people who also cover for me when I'm doing things like this, in addition to being willing to speak as part of our faculty. Lastly, I'd like to thank our guest faculty who have come from Johns Hopkins. They've come from UC Irvine in California, Vanderbilt, and with the Transverse Myelitis Association, Sandy Siegel from Columbus, Ohio. And I'd like to thank all of you for coming. With that, I think we'll have Ben come up.
Start us off, Ben.
Yeah, give us your best. I'll actually let